Glad to welcome you. This is Dr. Vasyl Chaika, and today we will talk about cough. Why does a cough occur? How does it progress? What do you really need to do to help yourself get rid of a cough? And what is strictly forbidden to do? What actually makes your condition worse? Let's get started. Of course, traditionally in medicine, and you hear this in advertisements, cough is considered a disease. Cough needs to be treated. Some say not to treat it, but to stop it. So you are constantly shown that cough, duck, is something dangerous that attacks your body. But when you turn to conventional medicine, to the textbooks that medical university students and every doctor study from, you will find that cough is described as a protective reaction of the respiratory tract. So the question arises, why do we treat a protective reaction? Why don't we want this protective reaction to manifest in us? That is why cough is a defense mechanism for our body, and in particular, it protects the airways by preventing anything from reaching the alveoli of the lungs so that gas exchange is not disrupted. Because we can only live on this planet by breathing air. If something gets into the lungs or gets stuck somewhere along the airway, such as in the bronchi or trachea, then with the help of this protective cough mechanism, we are able to expel it. But you should know that there is also a type of cough that is not related to the respiratory tract. For example, people who take medication for high blood pressure. Specifically, this group of drugs is called angiotensin-converting enzyme inhibitors. And it is precisely this group of drugs that can cause coughing. So when a person takes these medications, they will experience coughing. Therefore, in this case, you don't need to treat the cough itself, but simply stop taking these medications or replace them. Another situation is when a cough appears that is not related to the trachea. This happens when a person has gastroesophageal reflux disease, in which case acid can enter the tracheal lumen, and as a result, a reflex cough will occur. In this case, of course, there is no point in treating the cough. You need to treat the gastroesophageal reflux disease. Cough can also occur when a person has pronounced heart failure. And here again, we shouldn't be treating the cough, but rather helping the person with chronic heart failure. But if we're talking specifically about a cough that affects our airways, we already know that this is the body's first defensive reaction. But why does this reaction get triggered? Because, and this is important, the process of healing the squamous epithelium, which covers all our airways, is taking place. This includes the mucous membrane of the nose, the mucous membrane of the larynx, the trachea, and the small bronchi. All of these are lined with squamous epithelium. And what's important is that when it heals, water accumulates there. Swelling occurs there, and in order to reflexively remove all those repair byproducts, you experience a reaction called coughing. After all, when you start renovating your home and need to take out the trash, you don't kick out the crew that's helping you with the work. That's why you need to learn, as they say, to think logically and correctly from a biological perspective. But our medicine says something completely different, that you need to destroy to stop this cough. So basically it's like, when we start renovations, we should destroy the builders, for example, or the crew that's taking out the trash. There are a lot of such paradoxes. But let's figure out what really needs to be done so that this reflex reaction works properly and actually helps us. So first of all, you need to clearly understand for yourself, the first thing we must start with is that cough is not a disease. We do not treat cough, we create the right conditions. Often people might say, wait, a dry cough, you can just leave it untreated. But for example, if you have a wet cough with phlegm, and that phlegm is already green, or for instance yellow, then that's a disaster. That means bacteria have become more active, they've penetrated deeper, our airways and immune system can't cope, and this needs to be treated intensively. In fact, there is nothing that needs to be treated at all. In this case, we simply need to create the right conditions. At night, the process of creating these conditions begins. Here, from your perspective, a cough is considered normal. It's a protective mechanism. And it only occurs when the flat epithelium of your airways is healing. When you have this understanding, then we can move on to physical methods. Among physical methods, we need to create conditions that allow the cough to occur. That's why in the room where the child or adult is staying, there needs to be humidity, 65 to 75%. And this air should have a temperature of 18, at most 19 degrees, meaning humid, cool air. So how do you achieve this? Of course, in winter, you can simply open a window, and that will be enough. And the child, for example, who is lying in bed, sleeping there, you just dress them a bit warmer, and that will be enough. But if it's summer, for example, or if you're using heating devices, then we need to humidify the air, and the temperature will decrease. How do we do this? We can take a towel, any kind, wet it, and place it, for example, on the heater, or we can simply hang some damp fabric in the room. In other words, we need to create humidity in this space. Then, and this is a very important point, the mucus will not stick to the mucous membrane of the bronchi, and you will be able to cough it up. That is, a dry cough will turn into a productive one. But if the temperature in the room is 25 degrees or higher, because mom is cold, grandma says it needs to be warmer since he's sick and he starts coughing, then you are drying out the air and blocking the reflex from working properly. This will lead to the cough not stopping. It will persist constantly. For those who don't want to bother with all of this, as they say, then there are humidifiers you can use, and they can even show you what the humidity level is. We can also additionally use so-called vibration therapy to help improve the clearance of that same phlegm. For this, we can use devices like these vibromassagers. There are a lot of them available now. You simply take one, place it against the chest, and hold it in one spot for 10 to 15 seconds, then move it to another spot. And we can also use it on the back part of the chest. We can also do this on the front part of the chest. Some people say, oh no, you shouldn't do it over the heart because it will disrupt the heart's function. But in fact, it doesn't affect the heart at all. So you can do it over the entire chest area. You can do this procedure several times, 2 or 3 times a day. You can also do this yourself if you don't have such a device. Just place your hand on another person's chest and use tapping motions to tap all over the chest area. This will cause the coughing to intensify. This is normal. For children, you can simply tap with your fingers and that will be enough. Additionally, we can also use, so to speak, our diaphragm, the breathing muscle, to help. And for this, for example, if the children are small, you can't make them breathe correctly. For instance, if a child is breathing with their chest, we can do a little trick like this. Take a straw, put it in a glass of water, and ask the child to blow into it. That is, when they blow through this thin straw, they perform what's called a forced exhalation, which makes the diaphragm contract intensely and push out the phlegm. Adults can do this too, but they can use different variations of what's called diaphragmatic forced breathing. If we have a cough, a dry one, and mainly the dry cough comes from our throat, then in this case, we can use various types of anesthetics. The same lozenges that create a cooling sensation like menthol, or you can use lemon balm. They cool us down, and as a result, the cough is reflexively relieved. But if we have a wet cough in this case, then lozenges won't help us here. Here we can already use various types of herbal mixtures. What should we remember when using a herbal mixture? The purpose of a herbal mixture is first to make the phlegm more liquid, to stimulate its discharge, and to make the person cough. A very simple mixture is used for this. You can see it on the screen right now. It is very easy to prepare. Take 1 teaspoon of each herb, put them together in one container, pour 700 milliliters of hot water over them, and take 150 milliliters 3 times a day, 10 minutes before meals, for 14 days. If these are children under the age of 6, we can give them 50 milliliters. From 6 to 10 years old, we give 75 milliliters. From 10 to 12 or 13 years old, we give 100 milliliters. And after that, the dosage is the same as for adults. Of course, you can also use other herbs. The same linden, the same thyme or chamomile from the pharmacy. In other words, there is a huge variety of herbs that we can use, but the purpose of this herbal mix you saw on the screen is first, to make the phlegm more liquid. Second, to improve the expectoration of phlegm. And third, to make the person cough it up. So it's 3 in 1. That's why, in my opinion, this mix is exactly one of the best. It's very important to remember that you shouldn't try to get rid of the cough completely. Because people think that if they drink this, then by tomorrow the cough should be gone. No, that's not correct. A cough has its own stages. At first the cough is dry and thin, then dry and frequent, then frequent, shallow and wet, then frequent, deep and wet, then frequent, deep and thin, and only after that does the cough disappear. So if your child starts coughing, it doesn't mean, oh no, everything inside will burst and everything will be very bad. You need to understand this, not be afraid of it, and create the right conditions. Let's now go over the mistakes people make when treating a cough. Yes, the first and main mistake is steam inhalations, especially hot inhalations. People think you need to breathe in hot air to help clear out phlegm. No, it's actually the opposite. Because if you inhale hot air, especially children, you will sharply increase the swelling. And if, for example, this happens during the recovery phase, if the small bronchi are involved, you could actually trigger, as you say, a severe shortness of breath attack, and the child might even end up in the hospital. That's why you need to breathe humid, cool air. For this, for example, there are steam generators you can breathe from, and you can also use essential oils. But remember, not warm air, specifically cold air. The The second mistake is that as soon as a child or even an adult starts coughing, we immediately give mucolytics or secretolytics to stimulate expectoration. And here is one very important point. The more of these mucolytics and secretolytics you take, the more you cough and the more phlegm you have. It has already been proven today that such remedies, for example acetylcysteine and its derivatives, are strictly prohibited for children under 5 years old. Why is that? Because it produces so much phlegm that the child can't cough it up, and then complications arise. And what do people do at every turn? They immediately want to give something right away, quickly, to make the child cough up the phlegm. So please remember that it's better to use natural herbal remedies, biological methods, rather than immediately resorting to chemical substances. Because they can have a huge number of side effects, which of course will be mentioned later, not at the time when you are taking them. Another important point is this popular folk belief, this recipe, that when we have a cough, we absolutely must eat. Things like butter, in other words, eat a lot of fat, because it's supposedly good for our lung alveoli. Yes, there is some truth to this, because it is directly related to surfactant. Surfactant is a substance that coats the alveolus, preventing it from sticking together when you exhale. And this surfactant really is a phospholipid and is actually formed from components of the blood, directly from the blood plasma itself. But what is the important point here? When your bronchi are healing, and that's a squamous epithelium, no matter how much fat you eat, it won't help. That's why it's important. If the alveoli of the lungs themselves are involved, only then can you use fats in your diet. That's why, for example, in tuberculosis, the diet is very intensive. It's a high protein and high fat diet. Why? Because that's what actually helps. But if your throat is affected, for example, then no matter how much fat you eat, no matter how much you consume, it won't help. So remember, any method should only be used in a targeted way. Because yes, any method, or rather even a useful method, can simply be rendered useless. It gets negated and won't be used. And one of the most widespread myths is that through coughing, we infect others, because when we cough, the phlegm flies right at us, and there are viruses and bacteria in it, which we get infected with because we inhale them. This is the most common theory, which has never been confirmed. Why is that? Because when you cough, your flat epithelium is already healing. You can't infect anyone with anything. Let me give you a simple example. We, as students of the medical university, used to go to tuberculosis. We had a class on tuberculosis where we studied it. There we saw open forms of tuberculosis, closed forms of tuberculosis. We were all around it, breathing it all in, and no one got infected with anything. Why does this happen? Only when you, as I mentioned in the very first point, perceive coughing correctly as a protective reaction, when a person is really coughing, you understand that their body is healing, not that they're trying to attack you. Only then will nothing happen. If you perceive a person who is coughing as a threat approaching you, a reflex reaction is immediately triggered. The flat epithelium of the airways becomes thinner in order to drive away this enemy. In the form of a person who is coughing, as soon as you calm down, the healing process of the flat epithelium begins, and what happens to you? Coughing? That's why you can't catch a cough if you understand that it is a protective reaction. I think now you understand that a cough is not a problem and it's nothing to be afraid of. So, as they say, cough for your health. This was Dr. Vasyl Chaika with you.